So for those of you who don't know me, my name is Colleen Smith. I've been working with IHN for over 12 years. I'm a graduate of the program too. My title is I'm a head administrator and program advisor. I help new students register, and I also work in our Con Ed department. So we're excited to we're excited to have you hosting this with us today, or joining this with us today. So today's webinar is on comparative use of supplementation for stress and sleep-related issues. So a few things that you'll be learning in today's webinar is the pathology of stress and sleep issues, key statistics for different pathologies for both acute and chronic issues, the differences between choosing different products such as botanicals, nutraceuticals, or homeopathics, and then comparison of different brands to help you choose the right supplement. So for those of you that don't know our guest speaker today, it's Baljinder Chhoker, or Bal we call him. So he's been an educator and consultant in the natural health industry for over 20 years. He holds a Bachelor of Science degree in honors from the University of Waterloo, and he is a Doctor of Naturopathic Medicine diploma from the Canadian College of Naturopathic Medicine. So for the past 10 years, he serves as the National Educator and Consultant for BioClinic and Dr. Reckeweg. He delivers training for practitioners. And then he has also taught human anatomy and physiology with IHN. But the main course he teaches now with IHN is the supplementation in clinical practice. So I'm going to pass it to Bal, and he can share all his wisdom with you. Thank you for joining.
Thank you, Colleen. I'll just share my screen so they got the presentation up. Today you are here to learn about stress and sleep using supplementation. And this is what I do. I talk about supplementation. I teach supplementation. Don't ask me about food. That's what you guys are for, to discuss food with patients and how to make great impact on their life with food choices. But when it comes to actual therapeutics, food can't sometimes get people there. And this is when supplements really become handy to give you a therapeutic dosage of something to get them over what they're experiencing. All right, so whatever's condition that they may have, and get them back to normal. So today we're going to do the comparative use of supplements for stress and sleep-related issues. My name is Baljinder Chhoker, and this is basically an excerpt from my supplementation in clinical practice continuing ed course that I do. So as Colleen already mentioned, if you have any questions, please put them into the Q&A portion, not into the chat. The chat is for everyone to say hi to everyone else. But to the Q&A, then we'll go in order. And we'll go through hopefully all the questions by the end, depending on how many there are. I will try to do this in in hopefully an hour. I do have a tendency of going over that, but if I don't have any questions to answer while I'm doing this, I guess I should be okay. So bear with me, and we'll get everything done hopefully in time. So real quick, as Colleen already mentioned, I've been a educator and consultant for about 20 years now. I've done a lot of retail work, knowing all the supplements. I actually have a lot of labels ingrained in my head on the various supplements that even we'll be talking about today, along with all the ones I talk about in my course. I did teach human anatomy and physiology, and I think that was actually around 10 years ago. If I'm not mistaken, you might be able to remember this, Colleen. I can't remember how long ago it was that I did do some human anatomy and physiology. But I'll tell you, I hated that. That was all memorization stuff. I didn't enjoy teaching it as much, except for the second half. It was more clinical stuff. But then I got a chance to do the supplementation course. So supplementation in clinical practice. And that was a course designed completely by me. on a comparative use of supplementation for various conditions, and why it's important to do supplementation and all the different types of supplementation that are out there. So I really enjoy doing that course. I think this is the first year we're going to do it once a year now, so September, October. I have done it twice a year up until I guess last year. So we're going to hone it down. I realized I was actually the only one doing it twice a year, so probably a good thing I'm doing it once a year now. Okay. So today, what you read up and on and why you're here, this is really what it was. It's all about stress and how people handle stress. There are some people that are easygoing, some people who tense up, they can crumble under, the pressure, things like that. And the important thing is, does it really impact their life on a daily basis? And if it does, then you need to do something about it. But there's people like, and I'll give myself as probably one of the rare examples, that I don't give a whatever about anything. And, so I don't really take on stress. I don't care to take on stress. I don't think it's worth it. In the end, once you treat them, that's really the whole thing, is that realize, well, stress is kind of useless. All right. Yes, we need the stress of getting up and going to work and doing the general things. If we didn't have some of that, nothing would get accomplished. But to worry about it and have it impact your life for no good reason whatsoever, because either you can do something about it, so you will do something about it, or you can't, at which point then you got to say, well, okay, let's move on with this. All right, and live our life much easier. So the end goal is to get people to that point of, hey, yes, we can do something about it, so let's do something about it. Let's fix it up. If we can't do anything about it, well, let's accept it and move on from that point. And you'd be surprised what supplementation can do to get you to that point. Okay? Because if you do not, continued stress leads to a constant drain on the nervous system. This will weaken all other body systems. We'll look at that, okay? Lack of focus, clarity, tension, pain, anxiety, depression, insomnia. And we'll be looking at anxiety, depression, insomnia today, all right? But the immunity, the hormonal balance, everything can be out of whack if the body is unable to fight the stress, okay? And it can lead to deeper pathology if it is left untreated, where it can affect the growth, the immunity, and obviously nutritional deficiencies. But good thing is we got many tools that can actually help restore the system back again. So we're going to look at the supplements that are on the market. But there is a lot. And if you walk into a health food store and you go into the stress section or the sleep section, you can see there are, shelves and shelves of products that are labeled for stress, for anxiety, for depression, for insomnia. We're just going to today look at the key ones that you can start with to get the needle moving in the right direction. Okay, so we will discuss the pathology of acute and chronic stress. We will look at some of the stats for these things. And then we'll look at various comparative products. And we're going to look at botanicals, nutraceuticals, which most of you will be familiar with. But I'm going to look at homeopathics, essential oils, and even gemotherapy, which is a pure botanical medicine, not stones. Okay, so we're going to look at various modalities to help you, because not everyone likes all the modalities, right? Some people don't like supplements. Some people don't like homeopathy. So you know what? It's fine. If you have the options, you can do whatever you want with it. And I'm here to provide you the options that are available today. So health is not simply the absence of disease. It is a true state of physical and mental equilibrium. That's what a picture of health looks like. All right. It's not just dealing with the physical and saying, okay, I feel good. That's great. No, there's the whole mental aspect of it. And today's is a lot of the mental aspect to make sure the physical is good too. But the whole body has to be feeling good. All systems have to be functioning properly if you are looking at a good picture of health for that individual. All right, it's not just about kicking out that infection that someone may have and say, okay, infection's gone. Okay, I'm back to normal. No, that infection has left many other things in the system now that also have to be removed and recalibrated. So think about that. Think about the whole person when you are talking about getting them better. So let's look at a couple of little definitions here now. Stress, anxiety, and depression. Stress is the umbrella here. All of this other stuff falls under stress. So what is stress? A physical or psychological stimulus that can produce A, mental tension, and B, psychological reactions. So tension, tightness, everything going on up in the head, that's messing around with what you're able to do, right? And of course, with that, because it's mental and physical, you got the psychological reactions and the physical reaction, everything is there. And if chronic, if the stress is chronic, it will lead to illnesses such as anxiety, depression, insomnia, and even burnout, right? This is where we have to deal with the adrenals. This is where the main stress organ is. And we will look at the supplements for the adrenals in this case, the adaptogens. Anxiety. It's an acute state of intense apprehension or uncertainty and fear. Thing is, it's resulting from the anticipation of an event or situation, something that may or may not happen. Why are you stressing about something that may or may not happen? And then it's disrupting your normal physical and psychological functions. Right? That's anxiety. Thinking about the future, which may or may not even happen. Depression, a state of persistent sadness and lack of interest, resulting from either a biochemical imbalance or from a traumatic event in the past. So something that happened could have been 5 days ago, 5 years ago, 50 years ago, right? And that traumatic event is now embedded and it's throwing off the chemical imbalance in the brain. Something that happened ages ago and is now still leading to disruption of your normal physical and psychological functioning. So depression, I always say, is something that happened in the past, some event that you can't get over. You can't accept the fact that it happened, and there's obviously nothing you can do about it, so let's accept the fact that it's happened and move on. Whereas anxiety is you're in the future thinking about something that may or may not even happen, and is still disrupting today. So both of those things are not allowing you to live in the moment today, right here, right now. All right? Because if you're here right now, in the moment, there's no such thing as anxiety or depression. The stress may still be there. That's fine. That's the stress that keeps you going every single day. But there's no undue stress. So the key thing is, as far as I'm concerned, with all of these things, is to bring the person into the moment so that there is no disruption of that normal physical and psychological function within the body. That's the goal of all of this, really. So what are some of the symptoms of stress? I actually break it down in 4 categories. There's a physical, emotional, behavioral, and cognitive. So physical, all right? There's too many to list, but chest pains, rapid heartbeat. There's going to be some systemic inflammation, all right? So you're going to get stiffness and things like that too. It's going to throw off other things, but you're obviously going to feel fatigue. Some people also get gut issues where they might get diarrhea and or constipation. The emotional. There's the moodiness, agitation, the inability to relax. There's also the depression or general unhappiness or anxiety. Any one of these can be there. Then there's the behavioral. So as we go deeper and deeper into that stress, we're going further to the right as far as I'm concerned. Behavioral, there's the irregular sleep. There could be the addiction to alcohol, cigarettes, drugs, all right, that are you're trying to use to help relax, but obviously it's become an addiction now. It's actually not going to help you that much, all right, unless you keep on taking it, Okay. And then there's nervous habits such as nail biting, pacing, shaking your, kicking your leg all the time, things like that. Right. So those are behavioral things. And then there's a cognitive, the inability to concentrate. You got the memory problems. You got the poor judgment. They're anxious and racing thoughts. There's a constant worry. So it's not letting you, again, live in the moment. So you could have some of these. You could have them from one section only. You could have them spread out. Just depends on how bad the stress has taken over that body. It is easier to suppress, and I'll use the word prevent in this case. So it is easier to prevent evil at the start and more difficult as it grows because people ignore the small. They suffer by the large. To me, that is the pathway to chronic pathology. Okay, so pathway to chronic stress in today's lecture, but chronic pathology. If you do not take care of something at the very beginning, because people ignore the small, it will lead to deeper things, bigger problems. They suffer by the large. Okay, so you always want to tell your patients to deal with something as soon as they notice it, however trivial it may seem. Let's deal with it now so it doesn't take a hold in the body and make things worse. That's preventative medicine. That's what you're trying to do so that in the end, with all the supplementation and the food and changes and so on, what we really want to get them to is feeling perfectly well, letting food take care of and exercise take care of their main everyday things. The end goal is to get rid of all the supplements, get rid of all the medication. All right. That's the preventative side of things. But what are the effects of chronic stress if they've left it too long? Cortisol imbalance, number one thing. That's your adrenals, right? Cortisol is released from the adrenals. Cortisol imbalance, which will then also give you the HPA axis dysregulation. Hypothalamus pituitary adrenal axis dysregulation. Glucose imbalance, which is actually to me one of the biggest problems that you can have. Now you're throwing off many other hormonal aspects within the body. There's also the immune activity that lowers or hyperactive, meaning allergic state. Depends on that person what their susceptibility is. Some people will get more infections as their immune system lowers due to high stress, or some go into a hyper state and they become allergic to things. The other thing is inflammation. Systemic inflammation will happen. Gastric ulcerations, memory impairments, okay, and decrease in sexual response and function. These are all the effects of chronic stress on the body. Unchecked, keeps going, making things worse, going deeper and deeper into the system because, again, you didn't take care of it at the beginning stages. So what do we normally end up? What do we see people having with chronic stress? Suppressed immunity, hypertension, type 2 diabetes, metabolic syndrome, a lot of carbohydrate cravings. You'll see fat deposition on the face, neck, and belly. But you will also see bone and muscle loss, insomnia, decreasing energy, and even the addictions that I talked about earlier. So there's a lot that will happen with chronic stress. This is what they're going to come in presenting with. So you know that, boy, oh boy, we need to deal with and balance the body's response to the stress. You can't always get rid of the stress, but you can help the body respond to it better. So let's look at a couple of stats here when it comes to more so the mental health aspect of the stress. 70% of mental health problems. Okay, sorry, and this is going back to 2014, I should tell you, okay? So 12 years ago now. 70% of mental health problems have their onset during childhood or adolescence. Young people between the ages of 15 to 24 are more likely to experience mental illness or substance use disorders than any other age group. So this is your high school to university or the early couple of years of work or lack of work, depending on the situation. right? That's the 15 to 20-year-olds, 24-year-olds. 34% of Ontario high school students indicated a moderate to serious level of psychological distress, so anxiety and depression. 14% indicated a serious level of psychological distress. Okay? Men have higher rates of addiction than women, while women have higher rates of mood and anxiety disorders. People with substance use problems are 3 times more likely to have mental illness. More than 50% of people with substance use problems have co-occurring mental illnesses on top of that. And Canadians in the lowest income group are 3 to 4 times more likely to have these than the highest income group. Okay, when it comes to mental health issues. So that's more undue stress on them because of, again, the lack of opportunity for them. So it tells you the more money you got, there's a lot more opportunity, there's less stress on the body. And a lot of it is then created stress. The next one is for young kids. 2013, again, 3 million Canadians age 18 or older reported that they had mood and anxiety disorder. Sorry, this is still the adults here. I got one more slide, I think. In 2013, 3 million Canadians over the age of 18, so just about 12% of the population reported they had mood and anxiety. More than a quarter of those reported that it affected their life. Well, what I've been saying from the beginning, if it affects their life, extremely, we've got other issues that are going on. Okay, so a lot more challenges. Some of these people, about 20%, I'm going to say, sorry, about 75% consulted a health practitioner for this. But most people with mood and anxiety disorders are currently taking prescription meds. That's 93%. All right, are actually on medication. So you also now have to look at what medication are they on, and whatever supplementation you can give, will it help or hinder, or will not interfere at all with it? Okay, and most people, they can, if they know what's going on, they can actually get back their sleeping habits. They can get the activity and exercise and meditation practice going on. But if they are uninformed, they can't do any of that and just compounds. And sorry, this is the one for the youth, mental behavioral issues. And this is actually almost 20 years old now, but the numbers are actually just going up. Emotional problems such as anxiety. All right. So again, youth. 5% of children between the ages of 2 to 5 years old, this is preschool, are exhibiting high levels of emotional and anxiety problems. Hyperactivity or inattention, 7% of children in that same group exhibit high levels of hyperactivity or inattention. And physical aggression, 15% basically of the children of that age exhibit high levels of physical aggression, opposition, and conduct disorders. So this indicates the effects of stress and anxiety at a young age, and the numbers are only increasing as we go. So whether this is 20 years old, the other one's 10 years old, all the numbers are actually just going up in all the mental health issues. So this is how big it is and how common it will be that you see it. So, harmony and well-being come from the understanding that human beings are complex living entities in which the physical, mental, and spiritual are one. Any doctor who concentrates only on one aspect cannot pretend to completely cure any pathology. Going back to my first quote, the whole person. You have to make sure that you are treating the whole person if you want them to be well. Okay, so physical and mental, but there's also a spiritual side too, as this one shows. All right, so make sure that you're looking at the whole person, all right, to help them get to better mental clarity and focus, decrease irritability, improve sleep and sustained energy, emotional and hormonal balance, better coping and adaptation, and control of their cravings and addictions. If you treat the whole person, then you will definitely treat their stress and anxiety. And this is the stuff that you're going to be seeing happening if you are doing it right. All this stuff will get better. So before we talk about actual supplementations for this, when we talk about adrenals, anxiety, depression, let's talk about the basics. Because if you don't have a foundation, what good is adding on all the other stuff? So I think one of the most important things that you need for general maintenance is magnesium. And there's, I think it's also the number one mineral that people are deficient in. And there's many types of magnesium out there. In fact, one of my lectures, I think a quarter of my lecture is just talking about all the different types of magnesium that's out there. But what you do see is glycinate and threonate. Those are the two common ones that are for mental calming, brain calming, relaxation, anxiety, things like that. So those are, I think, going to be the key magnesium that you're going to be looking for. You can have multivitamin minerals or greens. I prefer greens over a multi any day. It just gives you so much more. But some people don't like the color. Some people don't like the taste. Some people don't want it, mix it up. Then a multi becomes a lot easier. Vitamin D is very important. It does help with mood. There are particular probiotics that actually help with mood. The two I've got listed there, they're the ones that you'll find in anything that's labeled as a mood probiotic. Those are two specific study strains in combination that have been shown to help through the gut healing improve the mood. Essential fatty acids are very important, especially in a high EPA. So high EPA fatty acid will help with mood stabilization, inflammation, and actually even cholesterol balancing. Whereas DHA is more about structural support and retention, it giving you some recall. But for most of these things we're talking about with stress, inflammation on the body, and the mood all over the place, something with a high EPA essential fatty acid is what you're looking for. So basically it's going to be a fish oil. All right. There really isn't a true plant-based or vegetarian oil that can give you a very high EPA with respect to a DHA. Proteins, amino acids, very important. Amino acids are the building structures of practically everything in our body. And I think proteins is probably the number one deficient macronutrient that's out there. Amino acids help build your neurotransmitters. There's your mental health. Build your antibodies. That's your immune system. And then, of course, what everybody else knows that, protein does and amino acids do is help with your muscle recovery. But there's the internal muscles, which is the whole gut side of things, and the external. So very important to make sure that they have a good amino acid content. And then you can also look at detoxifiers, cleaning up the system, getting rid of all the crap that's in the system. All right, that's blocking pathways and not letting things absorb or at a cellular level do what it's supposed to do to heal. So things like alpha-lipoic acid, N-acetylcysteine, milk thistle, there's homeopathic guys out there too, whatever you want. But a good detoxification might be a great beginning step for anyone. And then once you clear up the muddy waters by doing the detox, then you really see what symptoms are truly left to deal with. And then there's neurological support. This is stuff we will talk about. GABA, passionflower, lavender, St. John's wort. So these are the things that we will add in, but make sure you have the foundational stuff always. So let's talk about stress. We're going to talk about the supplementation for adrenals, anxiety, and then depression. And then after that, we'll talk about insomnia too. So the adrenal glands, very important. It's got two parts, your human anatomy and physiology thing. The one I found so boring. It's all just memorizing. All right, but you already know this, so this is good. Two parts to the adrenals, and both parts secrete stress hormones. There's the inner, which is the medulla, and the outer, which is the cortex. When we look at the adrenal medulla, this is what releases epinephrine, or adrenaline, and norepinephrine. And these are responsible for a rapid response. because this is when it stimulates rapid mobilization of metabolic resources, increases our heart rate, blood pressure, blood glucose. We're going to feed things very quickly so you can respond accordingly. The fight or flight. That's when we look at the adrenal medulla. But then we got the adrenal cortex. This is what produces the glucocorticoids, the mineral corticoid hormones. So these form a backup response. These are much slower effect. This is when we look at long-term homeostasis, regulation of everything. This takes time. This is for the chronic stress, and that's why the slower effect. Balancing the cortisol so that we balance metabolism, immune, and get proper balance throughout the whole body. Get it back to a normal state. That's the adrenal cortex. So there are supplements that will have adrenal glandular stuff, but if you know what you're dealing with acute stress, then you want the medulla or the full adrenal. But if you are dealing with chronic stress that needs time to build up and get the body back to a normal state, then it's the adrenal cortex that you want as a glandular within those things. So we'll see a formula with that. The human body has been designed to resist an infinite number of changes and attacks brought on by its environment. The secret of good health lies in successful adjustment to changes. The secret of good health lies in a successful adjustment to changing stressors on the body. That's what we call adaptation. All right? The ability to adapt. Doesn't matter what is thrown at us. All right? If we can adjust this to that stress, the body will be able to handle it. And then again, be in the moment so that it can carry on and do what it needs to do. The body has the ability to adapt, but sometimes it's under such a toll. There's too much going on. The wires are fried. And so we throw things at it, adaptogenics, to help it do that much better. So now our comparative use of supplementation really comes in. The first one, the BioClinic Cort Align. One of the best, I think, overall formulas for long-term stress and even the short-term stress. Cort Align, aligning that cortisol, that chronic stress thing, right, that we talked about. That's how the name kind of comes along. But ashwagandha, which is the main ingredient in here at the highest level, is used for acute and chronic effect. All right. Number of adaptogenic effects, including modulating GABA receptors to provide reduction in anxiety and stress. That's what ashwagandha does. Everybody's got an ashwagandha. In fact, I think there's probably too many ashwagandhas on the market, right? But there are different types of ashwagandhas that have been studied. The KSM 66 is what they're using. Again, when you see a trademark of something, there's usually a study or two associated with it. So you're paying a little bit extra for that particular extract, right? Because there's something to back it up in most cases. But what makes this formula very unique is the full Relora blend, the Magnolia and the Philodendron. Relora, to me, is one of the best to help reduce stress and anxiety, right, and help balance the cortisol levels over the long run. So this, to me, is the long-term stress support guy, Relora, all right? The ashwagandha gives you that quick stuff. And then we got two other things, theanine and phosphatidylserine. Theanine, if you are familiar with this amino acid, basically it is to reduce anxiety, to give you calming focus and clarity. So when you're under a lot of stress, again, your mind goes all over the place. You don't have the ability to focus. Theanine provides that focus for you too. And phosphatidylserine, you think, hey, this is just a memory thing, but it actually has a great role in calming down the brain, improving mood, and helping with the stress response. So this is a wonderful formula for overall reducing anxiety, relaxation, and promoting relaxation, and giving that adaptogenic support for the body. So relax them, they'll be less anxious, and they'll be control of their mood. So it helps balance the cortisol and DHEA, both adrenal hormones. Great for underlying support of anxiety. That's the purpose of this guy. Now, normally you're just doing 2 tablets a day with this thing. And when you do anything for adrenals, try to do it morning and mid-afternoon. That 8 o'clock, 4 o'clock cycle of the cortisol. So you want to have it before 8 o'clock and probably in that 12 to 2 o'clock to start balancing out and giving you a steady support for stress, keeping things much more balanced. That's the general way to do most adaptogenics. Okay, there are certain ones you can do right before bed, so you have this general calming effect without the energy kick. But some of these things can provide an energy, and ashwagandha is still one of these that can provide energy on the body too. Okay, so Cordyline, one of my favorites. Next one is the CanPrev Adrenal Pro. This is actually a 2-in-1. This actually supports the adrenals along with the thyroid. So we see tyrosine. Tyrosine is used in a lot of the thyroid formulas, thyroid balancing, when you are stressed out, when you have low energy and your thyroid's out of balance, right? Tyrosine helps bring that energy back much better. It helps with the metabolic function. But the other stuff that's in here are all adrenal support. Ashwagandha, schizandra, Siberian ginseng, rhodiola. Those are all adaptogenic herbs. And along with that, you got some B6. B6, vitamin C, and even B5 are all adrenal food also. So you have in here, especially the rhodiola, the ashwagandha, the Siberian ginseng, all adaptogenic herbs to support the adrenals in reducing stress, improving the mood, balancing the energy out, all right? Getting rid of that depression, helping with sleep disorders. So this is a bunch of adaptogenic herbs that have the properties to help increase the body's internal resistance to stress. But the bonus in this is if you're feeling sluggish, which is a thyroid thing in most cases, you got the extra tyrosine to boost the thyroid, which can be heavily impacted by stress on the adrenals. So you're supporting the adrenals, supporting some thyroid, get that energy back up a lot faster. So again, 2 capsules up to 2 times a day. But again, this is done morning, mid-afternoon. That's the way to take this thing. Adrenal SAP from NFH. And in brackets, I got the licorice free. Obviously, they make one with the licorice also in it. That's just called Adrenal SAP. But I bring this one in play because licorice can affect the blood pressure over long term. High dosages of licorice root can affect the blood pressure. So if somebody is under a lot of stress and they also have blood pressure issues, you do not want to give them a formula with licorice. So this one here, ashwagandha, panax ginseng, astragalus, holy basil, which is a great calmer to the system, Siberian ginseng, so things that we've seen already. But we also have the B6, the B5, vitamin C, and some magnesium in here too. So everything to calm down, but provide some nervous calming, but physical energy for that stressed out adrenals. All right. So balancing. So you can do, if there's no blood pressure issues, you can go to the ones with the licorice again. So adrenal SAP by itself has that. But you do have to be careful if somebody has uncontrolled blood pressure issues. Then avoid any formula with licorice in it, because you do not want to elevate that thing. If it's controlled, I'm not so worried. All right. But you probably still want to stay with it, stay away from it. Because if you're doing this for 2-3 months, then you can get a constant increase in that blood pressure with the licorice in there. So you do, even if they're on medication, so you do have to be careful, because then the doctor will just up their medication when it was not necessary. And then I think this is probably the last one we got here, pure encapsulations ADR formula. This is an adrenal glandular formula with some botanicals. So total adrenal and stress support with synergistic blend of adrenal glandulars and herbs. So we got the panax ginseng. We got the eleuthero. We got the licorice root. So again, no blood. Anybody with blood pressure issues, they can't do this one. But one of the most important, or two of the most important things in here are the bovine or Bos taurus adrenal gland. So this is a bovine adrenal gland, full adrenal. So the medulla and the cortex. All right, that's what we have in there. But on top of that, down near the bottom, we got bovine adrenal cortex also. So this is great for long-term chronic stress. That added cortex in here, all right? And if you jump back a couple of slides, remember we talked about the cortex is for the chronic stress balancing. So we have a formula here that has the botanicals for the adaptogenic effect, the energy support that someone needs when they're completely wiped out, all right? But we've got the glandulars in here that are going to give long-term cortisol balancing. So people who are almost wiped out, fatigue to getting closer to failure mode, the glandulars are going to do a much better job to get them up and running. So build them up slowly, but more of the long term, balance it out. That's when you want to use the ADR formula. So usually, again, 1 to 2 capsules twice a day is ideal. All right, morning and mid-afternoon. That's how you want to do all of these things. So that's our adaptogenic formulas. Now let's look at, this is one's unique in the middle type of formula, but we're going to look at more anxiety support, and then we'll look at some depression support. So this one here, this is gemotherapy. So gemotherapy, you might not be familiar with, is using buds and shoots of a plant. So this is a pure botanical. This is actually springtime when those little buds start to pop up on those plants. Collect those, put them into alcohol, glycerin, water at the same time. And now you got an extraction that's much more potent than practically anything else. And it's really stem cell therapy of plants. Okay, so the reason why we use these are some of the best to rebuild and restore. So they're great long-term rebuilders of the system. So this formula here has got 2 gemmos, fig and ribes nigrum. Ribes nigrum is our cortisol like formula. It actually helps the adrenals with the stress. It's a nervous and hormonal balancing thing. Fig bud is used as a nervous system drainer and a balancer. Okay, so for deep-seated endocrine nervous system anxiety, that's what figs helps with. So stress-related emotional disturbances also. Fig is great for the bud, but when you've got digestive issues that are due to stress issues, fig is very good for that. So we got something that's actually helping the battered and bruised nervous system and the adrenals. So both of these are long-term support. But what makes this formula unique are those hydrosols, so from essential oils, the hydrosols, lavender, angelica, and neroli. Lavender alone, well, that's all we're going to talk about, is one of the best known anxiety support essential oils. It is wonderful for anxiety, nervousness, and sleep. It brings a whole balance to your thoughts. Yes, we got 2 others that are providing even extra support and balance, but with the spray or the drops, the essential oils, the lavender is really good for this acute anxiety support, whereas the 2 gemmos are building the system that's been weakened over time. So this is a 2-in-1. And then we got lavender by itself. Lavender, again, as I just mentioned, great for anxiety management. These are lavender oral pills that you can do. All right. So for symptoms of stress, digestive discomfort, but really excellent for anxiety management. So you can take a lavender pill, and within about 15 to 20 minutes, that anxiety starts to calm down. That's how good this is. But if there's also intestinal cramping and things like that that may be happening, it's actually going to get rid of the spasming on top of that anywhere within the body. So you can do these little pills as needed to balance and get rid of the anxiety that someone may have. So again, powerful antispasmodic, accommodative, sedative. So we use this, as I said, for all types of cramps, spasms, but really good for stress and anxiety and agitation of some kind and problems of nervous origin. So if you got spasms through the digestive system, respiratory system, it actually helps to calm all of that down. Lavender is a wonderful nervine and antispasmodic. Straight up anxiety. Nothing will beat what GABA can do. GABA is the fastest acting thing you can have for acute anxiety. It balances the excitatory effects of glutamate on neuronal activity. So it is one of the best anti-stress formulas you can have. Now, you can take pills of it, but nothing beats the chewable either. So the chewable, within about 5 minutes, people will experience this, just that calming effect. Gives them focus, clarity to think. All right? Gives them that anxiety support that they're looking for so they can have focus and clarity and deal with the situation at hand. Yes, it may last only 4 to 6 hours. That's fine. You can redose as needed. But if somebody has acute anxiety and it comes and goes, chewing GABA, probably your fastest acting thing you can have. Lavender will probably be number 2 on this scale. And the homeopathic for this is what I call, as VC15, what I call shut the mind off tonic. All right. So it stops the wheels from turning in the back of your head from these repetitive thoughts. So there's a homeopathic to help calm the nervous system down, get rid of nervous exhaustion and weakness, get rid of the acute anxiety and the inability to concentrate. And usually when something gets stuck in their head, some emotional trauma, grief or something like that, and they keep thinking, what if only I had, right? If only I had done this, if only I had done that, and that's now playing in their head, VC15, the homeopathic, calms all of that down, shuts the wheels from turning in the back of your head, give you focus and clarity, lets you function throughout the day. It gives you the ability to fall asleep better without being a sleep tonic, just a mind tonic. All right. So it's got lots of vitamin C in it, but the homeopathics have their place in what they do with the nervous system. So this is something that you're going to do teaspoons or tablespoons of. Normally homeopathics, we're doing like 10, 15 drops. This is a tonic, so we're doing 2 teaspoons to about a tablespoon or so as needed to calm the mind down from all those repetitive thoughts in the back of your head. So this is really good for that acute anxiety that's going into more of a chronic state. VC15 will do a better job than the GABA at that point then. And this is the transition guy from anxiety and depression. Pascoe's Neuropath Balance. It's got St. John's wort, valerian, and passion flower. Passion flower is a great herb. I think it's number 3 after GABA, lavender. Then there's passion flower, which helps with anxiety support. So it has this mild anxiety support, but it has St. John's wort, which is the number 1 antidepressive herb. So this is an uplifting for the mind. It gets rid of that restlessness, also the mental stress, okay? But it has got lots of mood regulation because St. John's wort is the number 1, as I said, botanical used for depression. So it gets the mood up. So instead of that lull, everything's being sluggish, you're always down, St. John's wort brings them up. So if somebody's got some depression with the acute anxiety in between, this is a wonderful formula to take, 2 tablets 2 to 3 times a day as needed, and you won't have any issues with it. St. John's wort, you do have to be careful with some medication. You don't want to take St. John's wort. It can really enhance that medication is the biggest problem that people will have in most cases, but there can be some interaction, so be careful of that. And then there's Blissfora, Sammy. Sammy is probably the number 1 guy for depression. GABA was anxiety, Sammy is depression. It is probably the fastest acting thing you will have for depression. Okay. It is used for many different things, but the main thing is an antidepressant. Yes, it's a methylation DNA. It is actually used for cartilage formation also. It's used for liver support too. Expensive for all of those things. But at 400 milligrams, it is really one of the best antidepressants you can find and the fastest acting. It is very safe. Really no contraindication with drugs. The only contraindication is if somebody is bipolar. It will increase their manic phase. But otherwise, it will raise the serotonin levels in the brain, okay, and get rid of that antidepressive activity that's in the brain. And it is so safe that even pregnant women can take SAMe. It will only enhance any medication somebody's on, so you basically cut back that dosage eventually. But that's how good SAMe is. Bipolar patients are the only ones who can't take it. The other thing is it's very unstable, so it has to be enteric coated. Enteric coated is where there's a coating on the tablet that it will not break up in the acidic environment of the stomach. It will go into the small intestine where it's more alkaline before it breaks up. So if it's not enteric coated, it's useless. If you break up the tablet, it's useless. So you actually have to swallow the pill as is with the enteric coating on it so that it will become useful once it gets into the small intestine. Okay? But the fastest acting thing you got for depression. So within a week to 2 weeks, people start getting that uplifting mood when it comes to SAMe. The physician is obligated to consider more than a diseased organ, more even than the whole man. He must view the man in his world. So we've been talking about taking care of the whole person the whole time, okay? But now, when you really look at that whole person, that environment that they're in is that whole person. So yes, there's the physical, mental, and spiritual that we mentioned earlier, but now we have to add in the environment if we truly want to help them. And their environment can make a huge impact, whether it is family members, whether it is that work that they have, whether it is when we think about just general allergy season that's there, or molds in the fall, right? You have to deal with the environment on top of that if you want to take care of something. And sleep is actually one of those things that you have to look at everything. Insomnia is generally a state that manifests due to the effects of chronic stress and anxiety on the body. All right? Is it work stress? Is it home stress? Is it inflammatory stress? What is the stressor? All right? It can be caused by erratic hormone function, alters the body's production and utilization of melatonin. Generally, we use nerve relaxants and anti-anxiolytic herbs, things that we just talked about, which will have a sedative effect. Okay, so we'll look at extra ones that have that sedative effect, all right, to aid the mind's ability to fall asleep. So when I mentioned VC15 earlier, the homeopathic, I said you can use it for sleep purposes, not because it's actually a sleep formula, but it gives the mind the ability to do something. It calms it down, so now it has the ability for it to sleep if you give it the right stuff. Okay, so this is why sleep is, as I said, effects of something of stress and anxiety. Make sure you are taking care of that adaptogen side of things, the anxiety or depression side of things, before you come in and just give sleep stuff. Just by giving the sleep stuff, you might notice it's not working. People give melatonin to people all the time, and they say it doesn't work. Well, really, melatonin probably doesn't work for about 60-70% of the people because it's not a true hormone production issue. It's the lack of ability to fall asleep that these people have. So the hormone's not going to do anything for you. So make sure you take care of that stress, anxiety side of things too before you tackle the sleep stuff. So what do we have for sleep? We've got melatonin, number one thing. This is your sleep hormone. All right. It is produced by the pineal gland, responsible for managing the circadian rhythm, which is a sleep-wake cycle. That's your anatomy physiology done. But melatonin production tends to rise at night when it is dark outside, making you sleepy. All right. And it declines during the day. So very important. If you want to help someone sleep, first things first, lights out completely. If there's any light out coming from those curtains they have, get some dark blinds behind it. Complete. The darker that room is, and obviously less noisy too, but the darker that room is, the greater the production of melatonin that will happen. So if somebody's sleeping with a night light on, it's not helping them fall asleep. Right? The melatonin production just will not happen to the extent that they need to. That's just facts of how the body works. So completely dark outside or in that room is how melatonin production is going to start to happen. All right. So we want the natural production as best as we can. We're going to top up to get to that for people who actually do have true melatonin issues. It helps to reset the body's sleep-wake cycle. Helps to increase the total sleep time in people. All right. Great for jet lag and shift work people too. And it helps to reduce the time it takes to fall asleep. Now, there's different types of melatonin. This one here is a quick-acting spray. That's why it reduces the time it takes to fall asleep. Because the first question you actually have to ask people when they say they have sleep issues is it a tough time falling asleep or staying asleep? Because if the answer is falling asleep, then you want the quick-acting melatonin, whether it's those sublingual pills or this wonderful spray that you can adjust accordingly. Normally you do 3 to 5 sprays for adults, but kids you might do 1 to 3 sprays because it's only 1 milligram per spray, so you can adjust the dosage accordingly. You do melatonin to get the cycle right. Now, if it takes 4 weeks, 4 months, whatever, to get that cycle right, and the body to produce its own melatonin, that's how long you do it for. Because the more you give, the more the body will eventually produce, and you need less and less over time. Okay? But this one here is to reduce the time it takes to fall asleep. If somebody has a tough time staying asleep, then the time release is what you want. So CanPrev's got melatonin 3 milligrams, sustained release, meaning it will be released over 6 to 8 hours. So the key thing about a time-release melatonin is that you want to take this 8 hours before you get up. So if you get up at 6 o'clock in the morning, 10 o'clock is the last time you're going to take this thing, because otherwise you will feel groggy. And if you got to get in the car and get going, right, not a good idea if you still have some of this melatonin hanging around your system. Okay, so the key thing is 8 hours prior to waking. That's very important. And if you can try to do it 1 to 2 hours before bed, great. That's how the time release will work the best. So basically what you're trying to do is people who get up in the middle of the night, all right, and they start thinking or whatever it is, this is to shorten that time that it takes for them to fall asleep. So they're going to get up less and less. All right. And the time for them to fall asleep is shorter and shorter. So it becomes eventually one long sleep cycle. Released over 6 to 8 hours to get that system going. Now, this takes about a week to kick in. The other one takes the time you take it, it's going to kick in. So there's a big difference on how time release and regular melatonin works. Okay. So time release for those people who need to, get up in the middle of the night, just start thinking, and they can't get back to sleep properly. Take some time to get them to shorten that time frame, but something that will work much better than for most people, giving them the quick release. All right, most people have a bigger problem staying asleep than falling asleep. And then those botanicals we talked about, those things that are going to help people fall asleep. Okay. Sleep 8 is a formula that contains a bunch of botanicals, a couple of other things that help to balance the nervous system, get some melatonin in the system, and give them the long-term ability to sleep much better. Passion flower, hops, skullcap, chamomile. These are all herbs that have this ability to calm the nervous system down, right, and get someone to fall asleep much better. Relaxation. of the mind. We have some good magnesium in here. Okay, magnesium glycinate. We got a little bit of melatonin. Now they got a new formula with even higher melatonin, again, to put them to sleep much faster. And there's this Panax notogen, or the Sanchi herb, which has been very effective for treatment of general anxiety disorders and insomnia. So those people whose mind does not stop thinking, and what am I going to do tomorrow? What's supposed to be like, blah, 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 blah. Sanchi actually helps calm that side of things down so they can fall asleep much better. So probably one of the most complete and strongest formulas overall for sleep purposes. You can do anywhere between 1 to 2 capsules twice a day. And when we talk about twice a day for sleep stuff, by the way, it's about 1 to 2 hours before bed and another dosage right before bed. So again, 1 to 2 hours before bed and a second dosage right before bed is how you want to do these, just nighttime. But this is a long-term balancing of the system out, all right, and wiping out the ability to if they're having abilities falling asleep, and also long-term getting them to sleep cycle straight for 6 to 8 hours. And the last thing I have here is the Noctagem, another herbal gem product. So we already talked about fig in the CalGem. Fig, as I told you, was that nervous system balancer. All right, so bringing up the nervous system that's been battered over time, balancing it out so that it's not going hyper or hypo state. But we got Tilia in here also. Tilia, you might be familiar with as a lot of people as being a heart herb, but it is really a great nervous system herb for physical and mental calming. So people who have restlessness while they're sleeping, Tilia actually helps to calm that down. So you got the nervous system calming and balancing with the fig, and the physical calming with the Tilia. So that restless sleep that people have. So it relaxes both the physical and the mental, get them sleep much better long term. All right, this is not one for acute. This is a long term, again, underlying support thing. So again, taken the same way as I mentioned the last one. In this case, you're going to do about 5 drops about 1 to 2 hours before bed, and again, another 5 drops right before bed. Long term, balancing the system. So this can be thrown in with all the other sleep stuff that we've seen if you need to balance it out, if it's been chronic sleep issues, chronic stress issues. So really good for that purpose. I do believe I'm almost there. I cannot teach anybody anything. I can only make them think. That's what this whole lecture is about. All right? Give you a little bit of knowledge. I want you to think, take from that and build whatever you want to. Leave what you don't like and take what you do, and make yourself better. In the end, I'll leave you with this, guys. All learning is in the learner, not the teacher. So as I just said, take what you want, run with it, leave what you don't like, all right? Because you're here for your own learning, not for me to just give you my simple opinions and think that they're gospel. It's not the case, all right? And that should be with anything and everybody, all learning that you do. That's the way it should be. Here's how to get a hold of me. If you have any questions about the course, there's my cell, call or text, there's my email. And I do believe I capped it at 24, Colleen. You can probably correct that if that's the case. I was pretty sure that's what I did this year. It used to be less than that before, but since it's once a year, that's what we've got. All right.
Okay.
Colleen, you're back, hopefully.
Yes. Okay. Thank you for sharing all your knowledge and your wisdom with us. It was fabulous. Okay. I'm going to go and read through all the questions.
Okay.
Okay. So there's a few in the queue in the chat. So I'm going to do those ones first. Okay.
People weren't listening, weren't they?
Okay. So are there any specific amino acids that are depleted by stress?
As I said, it's really about protein is just the number one deficient macronutrient that people have. So I'm not going to talk about a single amino acid. I think that they are in need of everything. And proteins are the building blocks of everything. And really the 8 essential are what you need. Essential meaning the ones we have to get out of our diet. They will go ahead and produce all the other amino acids. But As long as you got the essential, the rest will build. So that's more important. So if I talk about just the essentials, there's a product called MAP, Master Amino Pattern. Go look it up. It's probably the highest absorbable amino acid formula that's out there, and the building blocks of practically everything in the body.
Okay. Would adding ashwagandha to the ADR formula improve the outcome?
They've done the formula that they want to, and as I say, you choose what you need. And I also said there's also so many different ashwagandhas on the market. It's funny that every company's got ashwagandha. There's no issues ever mixing things together. If you want to do things right by an individual, right, no formula is going to work for everyone. So if you need to top up and take an extra ashwagandha, if you think that that's going to do the job, add on to whatever it was, or if you want to take, I don't care, the very first formula that there was, the cordyline, and you think that they need an adrenal glandular, you can do that. You can make your own formulas however you want to. It's not a concern. It's about the individual and what they need.
Okay, so regarding insomnia, what if someone is going to sleep at a normal time, let's say 11 p.m., but is tossing and turning until 4 a.m. and cannot get out of bed until later in the day and the cycle repeats? What's the angle to treat that? Also, if they wake up feeling alert at a normal time in the AM, but the body feels too weak to get up, especially in the muscles, and they need to sleep for a few more hours just for the body to feel rested and want to get up out of bed.
Okay. So it's basically what I said at the very beginning of the sleep section. To deal with sleep issues, deal with the stress, the adrenals. So if you provide proper energy throughout the day, which will be used up by exercise and things like that, then they will be tired enough to go to sleep. As I said, you can't tackle sleep first. You have to tackle the reasons of the sleep problem, which is always going to be the stress, anxiety, poor diet, all those things. So go back and deal with those. Still give them something for the sleep. Again, if they're having a tough time falling asleep, the quick melatonin. If they're having a tough time staying asleep, the time release melatonin. But you have to give them their adaptogens. You could take that cordyline that I mentioned. You could actually do that right before bed if you want to. Right before bed, so the energy cycle doesn't kick in, but the cortisol calming does happen. Okay? So it's what you do about the cause, which is more important than what you do about that symptom that's been due to that cause. Okay, so deal with the day, give them the B vitamins for their energy throughout the day, give them their cortisol balancers throughout the day. All right, those are what's really going to do the job while you do still give them something for sleep. In this case, it would be a time release melatonin would be much better than a quick acting melatonin because they're staying up too long, right? But the daily energy side is going to be more important.
Okay, can you mix RVC15 with Bach scleranthus?
Homeopathics and Bach flowers, no issues mixing together whatsoever. I actually don't know what scleranthus is for. Sorry, I don't know the Bachs, even though we sell them through our BioClinic. But yes, you can mix. And again, it doesn't even have to be homeopathic in that. As I said, you can mix whatever you need to get the job done for that patient. But yes, no issues whatsoever mixing homeopathics and Bach flowers at the same time, even if you want to.
Okay. Okay. While under cancer treatment, I was told not to take St. John's wort, but to take saffron. Any comments or thoughts?
Yeah, as I said, St. John's wort does have some contraindications with medications. So that would be true. Saffron, a lot less. There may still be some, but it is also. So let's put it this way. I talked about SAMe being the number one for depression. St. John's wort, the number one utilized, right? But with contraindications, with respect to certain medications. Saffron is the one that's been in the last 5-6 years, that's been really coming along, that is used for depression, but also anxiety on top of it with less contraindications than St. John's wort. So I just don't have it in these notes, but I do have saffron in my course notes. All right, and I talk about it that way. So no issues doing saffron. Again, St. John's wort does have a lot more contraindications, so it makes sense.
Do you prefer NAC to glutathione?
Oh, back there. I prefer NAC because it's usually quicker uptake into the system and converts easily, and it's better priced. And the only way if you're going to use glutathione is it should really be the liposomal, which is very costly. So if you're going to do glutathione, and there's no problems doing it, make sure it's liposomal. And again, you're going to pay an arm and a leg for that if that's the case. But if somebody does have a conversion issue, you tried NAC and it's not working, then go to a liposomal glutathione, not just a regular capsule of something that won't do the job. It should be liposomal. All right, put the money out for it properly if you're going to use it. Otherwise, NAC will usually convert over easily and absorb easily and convert over readily over to the glutathione.
Okay. Have you had patients that are hypersensitive to ashwagandha, GABA, or L-theanine that causes them to feel more anxious rather than calming?
Only to ashwagandha. I'm going to say about 10% of the people I have seen on ashwagandha where instead of a calming state, they go into a hyperactive state. Yes, it's very common. It is not very common. It is common for that to happen with ashwagandha. And I think it's usually because their adrenals are basically close to failure mode. So they're hypersensitive. Somebody who's in a fatigue to, general stress won't have that issue. Somebody who is practically gone when it comes to adrenals, those are the ones that will react. And they will react, just this way or that way. You can't tell until you try it. But ashwagandha, not the other stuff.
Okay. To confirm the ADR formula for people who are wiped out, meaning stage 3 or stage 4 adrenal fatigue?
You're talking 3 to 4, exactly, at that level, because the glandulars, that's really when you're using them. So they're basically going from fatigue to failure mode, right? A burnout, close to burnout. There's a demo that we have for burnout also, but yeah, where they're getting close to burnout, that's where you're talking the glandulars.
Okay. The next question is, what about Bach flower remedies? I guess you want to know your opinion on
I've already mentioned that. Yeah, they're there. There's not an issue. Rescue remedy is the number one known. And if I was to actually take a step back, again, this is in the course. Rescue remedy is the fastest acting thing you have for acute anxiety. Within 30 seconds, it starts to calm you down. Problem is, you might have to redose 5-10 minutes later again and again and again and again. But it's probably the fastest acting. Lavender is the next fastest acting, and you don't have to redose as much. GABA would be the next fastest acting, and you do have to redose even less and less. So, and passion flower would be the next one. So there's no issues depending on what stage they're at. If this was just a one-off, something scared the crap out of someone, you know what, they got into accident, whatever it is, and they need that right now, or they got some stage fright, rescue remedy will be the best thing you can have. All right. If we're talking other Bach flowers, then you are talking a huge questionnaire, the individualized, and how many you got to mix. You might have to mix 3 or 4 of the Bach flowers together based off the questionnaire. So that is totally customized to that individual, which is still the best way. I don't know that, but I just normally talk about rescue remedy, if anything.
Okay, what are your thoughts on the use of CBD oil with no THC for stress and sleep?
Well, really, you need THC if you want to calm the nervous system down. CBD is about the pain. If there's pain that's causing insomnia, sleep issues, just any type of pain, major inflammation, then the CBD. But really, you need the THC, which is a nerve calmer. With that, some portion of it should be there for it to help with stress and sleep. If you recall I said stress, one of the key factors that happens long-term stress is high inflammation in the body. And so if they've gone to that stage, then that's where the CBD does come handy. All right. But you need the THC for the nervous system side of things.
Okay. SAMe, can this be taken alongside an SSRI?
Yeah, as I said, there's no contraindications of SAMe outside of somebody being bipolar. In fact, as I said already, it will enhance that medication, so you might have to be careful of cutting back. You might need to cut back on that medication eventually. That's how good SAMe works, but you can definitely take it with it, no problem.
Okay. Someone's asking if they can get a copy of your slides.
I will send them to you. You can forward them to them, or better yet, just email me. You saw my email, right? bscnd@rogers.com.
Okay. You don't know if anyone didn't catch it, then you can just email me and I'll send them an email. Okay.
Yeah.
Okay. Is there a limit to how long you can take botanicals or adaptogens?
I already mentioned it could be 3-4 months, depending on, again, how much stress or anything there is. If you're going to do it for more than 3 months, I always suggest giving it maybe a couple of weeks of break, 2-3 weeks break, and then coming back to it again. Let the body reset. But there's really no limit. Just give it a break. That's all I ask.
Okay, this next one is about the course. It says, is this course offered in person or online? So it's online.
It's online only. I wish it was in person, but it is online only.
So when we do it online, it's live on Zoom, and then the following day we send out the recording, and you get to keep it for 2 months after the last class. So if you miss like a live
2
one,
months. It's supposed to be 2 weeks.
Get the recording.
2 weeks. Change that. It's 2 weeks after the last class. After your assignments are done, there's no more access.
Okay. Okay, I think there might be one more question. If someone experiences diarrhea and constipation following different homeopathic remedies, is this normal?
Not that I've ever seen. So, because the homeopathics are wonderful in the sense that they will do what they're supposed to or do nothing at all. They're reacting to something. They could be reacting to the alcohol if there's a liquid. All right, that's a different story. They could be reacting to something else completely different, but that's not something that would happen with the homeopathic. As I said, unless it was a reaction to most likely the alcohol, because that's the only thing. Because sometimes the non-medicinals are a greater reaction than the product itself. And you have to know what the alcohol is made of, and you could actually have an issue with the type of grain the alcohol is made of.
Okay. Okay, that is all the questions. Does anyone have any last questions before we wrap up?
Where's the chat? Okay, so chat. Here, I'll put my email back into the chat.
Oh, okay.
And there you go. Okay, so if you want to get a hold of me.
Okay.
Yeah, so if you have any other questions or you want the notes, just email me.
Okay. Thank you, Val, for your time.
Thank you, Colleen.
If anyone's interested in the course, you can email me. Okay. Thank you, and have a wonderful evening, everybody.
Okay. Bye.
Okay. Bye.